Have you ever had an awful pain in your shoulder? Didn't know why? Well, you may have been suffering from a rotator cuff tear. Here to inform us about lowering our risk for those tears, we have orthopedic surgeon Dr. Scott King. It does seem like it's a common complaint, shoulder pain, and rotator cuff could be the problem. Can you explain, first of all, what the rotator cuff is and what it does?
So yes, it's a very common complaint. If someone doesn't have shoulder pain just to begin with, they usually know a relative or a friend that does.
Yeah.
But the rotator cuff is 4 muscles and tendons that surround the shoulder. And they start from the front and they go all the way to the back. And they provide stability to the shoulder to keep the ball and socket joint in place.
Okay.
They also help move the arm. So anytime you're moving your arm away from your body, whether it's forward, back, to the side, your rotator cuff is helping to do that.
So what happens that causes it to be torn or injured? Does it have to be something really dramatic to happen?
Not always. I mean, a lot of times, more often than not, it's something that the rotator cuff deteriorates over time. As we get older, the tendon changes and it degenerates over time. So oftentimes, a rotator cuff tear can be without any injury. But there's a whole spectrum of disease or injury to the rotator cuff. It can be from tendonitis and inflammation to the rotator cuff. Some people will have some overuse. Some people don't even remember doing any injury or having any injury. And they just start having shoulder pain. And then that's the spectrum to where you fall or you're lifting something very heavy and you feel a pop or a sharp pain in your shoulder. You know, then that can obviously be a tear to your rotator cuff causing that pain.
Well, you said a sharp pain. Is it always a sharp pain? Like, how do you know if you just strained a little bit or you did tear your rotator cuff?
So the symptoms of a rotator cuff tear or inflammation and disease are usually pain and weakness. And it can be to the front of the shoulder or it can be to the side, sometimes even the back. So it's always somewhere surrounding the shoulder. And it can be an aching type of pain, it can be a sharp pain. And sometimes people will even have weakness that's associated with pain, but sometimes they can have it that without pain, and they really just can't lift their arm away from their body. That's usually a telltale sign of a big tear to your rotator cuff.
Is there somebody who's more at risk of this? Can we reduce our risks?
So usually it's older patients. As we get older, like I said, the tendon degenerates over time, so that can put you at more risk even without an injury of developing a rotator cuff tear. But as your tendon deteriorates over time, degenerates over time, then even like something like a normal lifting, like a gallon of milk, something like that, can actually cause a tear to your rotator cuff.
Okay.
And then more laborers where you're doing repetitive overhead, repetitive reaching in front of you. That repetitive motion can cause wear and tear to the rotator cuff, causing a tendon tear.
Interesting. Of course, if anybody has more questions or maybe concerns about this, they can contact O.S.S. Health. You have 2 locations, Mechanicsburg and York,
Yes.
So that folks can give you a call. Also, we have a web chat happening right after the show. That's at 1 o'clock today, so you can ask Dr. King questions and get more answers about rotator cuff tears or other ailments you may have going on in your shoulder there. Dr. King, thanks for being with us.
Thank you very much.
Good to have you.